Ms. Tanya?
Here.
Mr. Falcon?
Here.
Here. So we have a quorum, we have 5 present, correct? Item number 4 is approval of the minutes from the April 24th, 2025 meeting.
I move that we approve the minutes
Have a motion to approve the minutes.
for the April 24th, 2025 meeting.
I'm looking for a second.
Second.
We have 2 seconds. I don't know who won that. Do I have a motion and a second? All in favor, aye?
Aye.
Any opposed?
I'm gonna abstain.
Have 1 abstention? Any opposed? None? That, the minutes are approved. Public comment. Each speaker will have a 3-minute time limit. And we'll look at each individual heading on the agenda. When we get to it, I'll call for public comment. Okay. Reports of standing committees and Mr. Shelton.
All right, well, good afternoon, commissioners, good afternoon to leadership, and good afternoon to our community. We are very excited and glad to have each and every one of you here today. So before you, I'm going to go over very high level our income statement for our financials for the month, as well as our balance sheet, as well as our sales tax and our capital analysis. And then at the end, I'm going to do a complete budgeted analysis of where we are for the month to date and where we are year to date. So we had a very good month in the month of April. Net patient revenue, we 1.4 million from budget of 343,000. Other operating revenue was at 742,000 from 219 that was budgeted. Our revenue is at 2.1 million, and we budgeted for 562,000. Let me explain a little bit about where we received those numbers.
Can you make that any bigger, or is it just me that can?
So I do have it. I do have the financials in your board.
It is small.
Can I have y'all please invite on that side?
This is here? But they need to see it.
Hold on.
Thank you. So net patient revenue, 1.3 million. From Athena was at 1.2 million of patients and our revenue that we brought in. Looking at non-operating expenses, employee-related expenses at 555,000, purchase services at 620, general office at 243, occupancy is at 106, supplies details at 120. Broke out 192,000 from what we budgeted for 201,000. Net operating expenses total 1.4. We ended the month after we paid all of our bills. We ended the month at a positive of 685,469,000. Let's go over a little detail of where we got and how we got there. So we had a very high month in patient volumes, as well as the procedures that we have been working on and doing. We have improved on the billing practices. And as I get into the new business, I'm going to show you where we started off a year ago to where we're at now and how we have improved on our patient incomes. All right. The first thing is on the amount of observations that we had for the month of April, 14, okay, which was a very good number. Secondly, the acuity of our patients. So now we're seeing that our patients are coming to us, we are taking care, we're providing those services that they need. For example, additional respiratory. And we had some pneumonia patients that we've seen now we can be able to bill for that. So that is highlighting where we're at. This increase reflects improved, like I said, billing captures, as well as our higher patient volumes. Also, it's showing that we was able to look at, for example, under purchase services, we had 380,000 that we had to pay out in some legal fees. In general office, we paid all of our insurance, so that hit us for this month. So we took care of that. Also for the occupancy, we had to make sure that our equipment was working and right. So I spoke with Mr. Wayne, with our maintenance team, and we was able to put all of our equipment now is on a rotation. So now we have a quarterly rotation. So that's why you saw an increase in our other expenses on there. So for the month, the bottom line is this. Net income for April was at $685,000 compared to $18,000 that we budgeted for. That is a net gain of $667,000. Let's just stop. We never thought that we was going to be able to have a net gain of $667,000. However, it's the work of the staff and it's the confidence that our community is giving back to our hospital. Patients are coming back. The community understands that we have our duty and we are doing our duty. And we're doing it in a respectful, right manner. So our revenue far exceeded the expectations, which offsets the higher than expected budgeted expenses. So net income performance is exceptional, strong, driven by increased patient volumes, then services, and our improved payer performance. So we have some expense that we're going to be working on. I've already challenged my staff to take a deeper dive into their expenses, see what we can cut from the fat. We want to start trimming that, but also making sure that I'll take care of patients first. So this positions us well as we continue to invest in further staffing, service line growth, and operational improvement. And this is our income statement.
So, do you have a year over year? Do you have a?
Yes, sir, that's going to be on our last slide. Yes, sir.
Okay, all right.
For our balance sheet, current assets, I like to do this, and you know this is every month. This is where we started off, August 31st, 2024, $7 million. April 30th, 2025, $30 million in current assets. Fixed assets, $6.5 million. Total assets that we have is $37.1 million versus where we started off in August 31st of 2024 at $33.6 million. Liabilities is at 1.4 versus the 295. Our fund balance is 34.8. Net income was at $840,000, which I'm going to explain at the end of our slide. Unrestricted fund balance is 35.7 versus the 33, giving you your total liabilities is at 37.1 million. But this is reflecting an increase. So our key takeaways, okay? Our assets are continuing to grow. That's what you want. Indicating strong cash flow and smart investments in infrastructure and our equipment. Also, our liabilities remain low. Okay, that's what we want. Relative to assets, giving us significant financial flexibility. So we've seen a strong recovery in net income from prior year loss to a positive year to date, okay, of $840,000. This is what we lost last year, $746,000. Today, we gained $840,000. That is a complete $1.2 million turnaround. We pause because that is the strategic mission that the board has given myself and our team. That's the mission that we are providing for our patients. We never want to go into a negative and be in this situation again. Being able to have this aligns with where we want to go for the future and aligns with where we want to go for the district. So that's where we're at right now on the balance sheet. Board members?
When I look at the cash and cash equivalent, that actually didn't change that much. So it was somewhere around 400,000 at its change. And then you see it, we're seeing this $4 million change in the total. So I guess it brings the question of the investments that we have. Do we have something, or?
Yes, sir.
Where are we on putting that RFP out?
Yes, sir. So we are working with our current investment advisor, and we've looked at some really smart 3 years, 5 years, and 6 year bonds that we're going to be working on and looking at for our investments. However, for the RFP, because the board did approve for us to look at other options. So we're working to make sure that when we are able to provide we want to give them a clear snapshot of where we are financially, so they can be able to look at our current assets and be able to tell us exactly what they can do. Then therefore, I can be able to bring towards the board and be able to have several options before the board. However, right now, we have really been working with our current investor to make sure that we are doing what's in the best interest of the district. So that shows that we are taking this very serious, that we're not here wasting time, and I'm not here to play games. I don't play politics. I don't do that. I'm here to make sure that we are taking care of my patients, making sure that we are having smart investments for the district, and making sure that we are moving this organization forward. And that's how we're looking at it. And as I bring back before the board for the RFP, I want to be able to bring you 3 to 4 advisors in the community that you could take a look at, a really deep dive. But I want them to see a complete snapshot of where we were, where we're currently, and then for them to understand our vision of where we want to go and where we want to take this hospital and what they can do to be able to help us to get there.
So also, we've had a lot of expenses, over the past year, really over the last year.
Yes, sir.
So I think that's, also reflects on that number, which, I would assume that as we go forward more, it'll be more on regular maintenance expenditures
Yes, sir.
versus all of these had to have it today type things.
Yes, sir. Yes, sir. Yes, sir. So that shows our.
Have any comments?
Next goes to our capital analysis. Again, remember our board generously approved 1.7 billion for us. To date, we've only used 876,000, and we have 823,000 that is left for capital improvements. Questions on that one?
All right, you're moving along, staying within budget.
That's it, yes, sir. Next is your sales tax. So we received on 4/7, 166,000 from our sales tax. And in May, you received 217,000. That brings your total to 1.2 million year to date. That's your sales tax. Now I want to basically go into our budget review of where we are year to date. This gives us a complete snapshot of what we're doing and how we are doing, and then the success that I'm proud to be able to speak before you today. Net patient revenue, 1.3 million. Other operating, 742. That gives you 2.1 million here. We budgeted for only 562,000. After we bring out employee expenses, purchase services, net operating expenses 1.2, net operating performance year to date, 840,000. That's how we was able to have that on our balance sheet, that 840,000. This continues to show that we've had April was an outstanding month, okay? Both monthly and year to date has been outstanding. We significantly exceeded revenue targets thanks to strategic growth and better than expected volumes. Now, we do know that our expenses are elevated, okay? I take on that because as I have more patients, I told y'all before, as we have more patients, we're gonna have more expenses that I'm gonna have to accrue. Majority of it rests on my nursing side and my respiratory, because I have to have competent, trained staff to be able to take care of my patients. So that's why we are investing in our nursing staff and making sure that they have adequate training that they need. I've already spoken to Ms. Anastasia, and I told her, do not push out a nurse that have not been through a complete orientation for making sure that we're taking care of our patients. We're critical access. I don't have time to play with care. I need to be able to treat my patients when they come in the door. So she has been charged with making sure every staff, every nurse is trained to be able to handle any type of emergency situation that we have in the hospital. Not just that, but making sure that we're taking care of what's going on over there on the inpatient side as well. So as you see, as inpatients increase, your supply is going to increase. So we've been seeing that. We've been working with that. We have some inflation issues that have come up that we're working with. We're working with our GPO to make sure that we get the best prices on any type of supplies that we have. However, I will not shortchange my staff. I will not shortchange my patients. I'm going to give them the right supplies. I'm not going to just give cheap supplies because it's going to cost me, it's going to save me $5 extra. No, if it's going to cost me $5 extra, it's because it's at the recommendation of your senior leadership and your nurses and your physicians to make sure that we're taking care of the patients with the right equipment and right supplies.
Shelton, can you read that? This didn't print out these numbers on here.
Okay.
Can you read the month-to-date actual?
Your month-to-date actuals, so revenue, 2.1 million. Employee-related expenses,
Revenue was 1.3 million.
The net patient revenue was 1.3 million, right?
the net patient revenue, 1.3 million. Other operating, 742,000. Revenue, 2.1 million. Employee-related expenses at 400,000. Purchase services, 620,000.
Those show up, Shelton. It's just
Yeah.
the net patient revenue, the revenue where you have 2.1 million and the budget
The
for
summary that-
831.25.
Mhm.
Right there, those three columns right there. And then the next two underneath it, the three where it's the 831.25. Okay, those three, and then underneath those two, it doesn't show.
Okay.
That's
Because what I did was I went ahead and broke it out here. I just put a highlight in your board packet, but I can break this out further.
Well, it's an overflow.
Yeah.
It's-
You'll be able to see that. But that's just showing you exactly employee-related expenses and purchase services that we have.
One other point too, Shelton, Bill brought it up initially. In the future for meetings, we have to have it where what you are explaining on the board is something that everyone can see clearly.
Okay, yes, sir.
Everyone in attendance should be able to see it clearly. And,
Okay.
If not, then we need to have copies, enough copies for everybody. There you go.
Yes, sir.
You're talking about the finances, want everybody to make sure they see that clearly.
Okay, I will make sure we have that. We will do that.
I have a question, Shelton. I remember last year we talked about some amounts that we had to recover. Have we fully recovered all those amounts?
Yes, ma'am. So that's your next question. So net income is tracking nearly, and I shared this briefly with our staff last week. We're $2 million ahead of plan, okay? Position us very well ahead. We have recovered from your loss. We was at a loss of 1.4 million. We're at $2 million net. So that's where we are landing at today. As of this afternoon, you're $2.1 million ahead. So. Anything else on that? I just want to say that we have continued to perform well. We are demonstrating strong operational and financial health. We are managing increased services and the demands that we are seeing while maintaining a positive and a healthy bottom line. Our strategic investments in services and operational improvements are yielding measurable results. These are actual results that we can see. These results support our mission, our vision, and our values. And our abilities to always remember that we got to sustain high quality healthcare in Donaldsonville and for our communities that we serve. So I am proud to present these budget for each and every one of y'all, but I'm also proud of the work that our staff continues to do. This is not about me. This is about what we're doing for our staff each and every day and what our staff is doing for our community. It took a lot of work to get us to this point where we can be able to not have to worry about finances. Yes, we're always gonna worry about finances because I live off my cost report each and every day. However, to have a month that we can be able to smile and take a breather, it's a good month. But I don't take this for granted, okay? What I'm working on is not just about April and May. I'm already thinking about what we're gonna be looking at in November, December, and January of next year. Because I can't focus on the here and the now. That's why I have James and Quincy and Anastasia, they can deal with that, and Kevin. But I got to think about the future. And this concludes my report of the financials. I open my time for any questions from the board.
You know, I may have lost track of where we are, but this doesn't seem to be corresponding to what we have on the agenda. So we have reports of standing committees. Tell me which ones you gave us so far.
That's your financial committee and your sales tax.
That's the only two.
Yes, sir. Within your finance, we always go over your income and your balance, your sales tax, and your capital.
And what about this budget analysis?
That's the last part of your financial. Yes, sir.
That's part of number one.
Yes, sir.
Okay. Board have any questions? Okay.
All right, so monthly standard reports for social services, total patient visits was at 17, admits are 3, consultations 2, observations are 3, referrals are at 3. I did have 2 child abuse reports that we had to report. On my hospice residence, I had 3 patients, 2 PDC ER evaluations. Our community outreach, Dr. Lewis was able to work with grandparents raising grandchildren. We had over 200 participants that she was able to help with that. Looking over in our MEC and I, we met on the 20th of this month. We approved and accepted our report with 0 Medicaid admits, 0 denials, 0 physician quality problems, notice of facility quality problems, and notice of admission denials was all at 0, which is great. Your QA review, you had 2 admissions with 12 observations, 0 discharges, 0 deaths. You had 22 patients within your wound care clinic. For our specimen received for our ER, as well as my pathologist review was at 0. Imaging, we had 51 mammograms, ultrasounds was at 16, X-ray exams are at 202, and CT exams are at 139. Also looking a little bit, we had a total of 458 patients that were seen in our ER with 13 observations and 39 transfers to a higher level of care. We had 8 AMAs, and within 72 hours, we was at 11. Largest increase year to date at 453 on your patients that was registered. Again, total admissions from your ED was at 12, observations at 13, and transfers to another facility was at 39. As you look at this, the admissions as well as your observation, you see that that's increasing. That is yielding to your bottom line on your net patient revenue. 0 death, your left without being seen was at 5. AMAs was at 8, 72 hours returns, 7 with the same symptoms, and 4 that was with different symptoms. As we look at our nursing documentation, I was at 98% compliance, which was good. We did audit 20 records. The only thing that we had to pull out again was 80% on my pain assessment. But we are looking, we do have a PI project in place for that as well. Moving on to our test positives. Flu A and B, we had 35 that was ordered with 4 that was known as being positive. Strep A, we had 21 that was ordered with 1 that was positive. RSV was 4 ordered, 0 positive. COVID-19, we had 34 that was ordered with 0 that was positive there. As we look at our respiratory therapy stats, we had a total of 19 ABGs that was ordered. Our oxygen hours were significantly increased at 1,248, and I had 103 EKGs that was taking place for the month of April. Environmental care plans. So our Kenwood radio test was completed. All of our policies have been reviewed and approved. Your generator test, as well as our line isolation test, your medical gas testing, fire extinguisher inspections, our oxygen cutoff valves, and our ground fault testing, all was complete for the month of April. And we've had no problems with egress lighting. Our hazmat and our waste management plan was approved, and your emergency showers are all operational at this time. As we move on to our ITCT report, you see our Microsoft Rural Health Ongoing Cybersecurity Assessment. We did conduct our first meeting, and that was a great meeting. We had some good insight on what we need to be doing for cybersecurity. Your workstation conversion to Microsoft Intune is 70% complete. Our MCN solution policy management is working smoothly. We are in the process of branding and moving all of our policies so that we can bring our policies before our different committees and then moving towards our staff. In the past 30 days, we've had 1,239 exchange messages that were quarantined or recognized as phishing scams. This is up from 691 from last month. I do want to mention that this is significant. We are seeing throughout the nation that a lot of health systems are being attacked. I have made a personal investment with our IT team that I want everything that come through that seems not right. It need to be quarantined, and we need to make sure that we don't have any cracks coming into our operations. Our servers are locked down and secure, but this shows that we have some bad actors out there, and we are able that we can capture that and make sure that it doesn't get pushed out to our staff, which can inadvertently bring us open and bring us very susceptible to any type of viruses or anything. Our Microsoft Forms activity is up 225%. Microsoft OneDrive usage is up 17% as well. And Microsoft Teams activity is up 12%. We have started putting out our web group security training for our staff, focus on identify multi-factor identification. The quarterly user license and auditing has been completed for the month or for the quarter, and our Windows 11 upgrades are progressing with 65% completion for your workstations with compatible vendor software. And on our CEO report, this is for our leadership team. We had a great month. It was a fun month, and the staff really enjoyed what we did. We did have hospital week and nursing week. It was a great success. Monday, we had leading the way. So they had chicken and waffles that we was able to give out to all the staff. Tuesday, Mr. Dawson came and hung out with us, and we had taco about teamwork. So the staff was able to make some tacos and just relax there with our chairman of the board. Wednesday, we had Winging It Together, where all the staff was able to put out some very highlight of what they want us to do, how they're moving, where they want to go at, and what the hospital can do to help them continue to grow. Thursday, we had a good old crawfish bowl, and everyone loved it. We also had our vice chairman, Mr. Price, came and hung out with the staff, so that was great. And Friday, we was able to support our staff. We had our care time where we was able to make sure that the staff was able to wear our T-shirts and just being able to enjoy. Kevin, you have anything to say about Hospital Week?
It was a pleasure to serve the employees, as always. Thankful for our administrator, thankful for the board for allowing a budget for us to do something for them. They were very appreciative, and we got a lot of great feedback in terms of this being the first time for a lot of them in the history of the facility. They've had an opportunity to be appreciated during our hospital. So thank everyone for that.
We also was able to participate in Teacher and Staff Appreciation Week for the community, and we was able to provide breakfast to all of the schools. We had a lot of shout outs, and it was great. Ms. Mitchell, you want to say anything about that?
On behalf of Donaldsonville Primary School, that's where I am, we do want to say thank you. It was real nice, and they really enjoyed it. I enjoyed my fruits. So it was really appreciated.
Doc, you want to mention anything?
Yeah, well, just on behalf of Woodbury Middle and all of the West Side schools and LeBlanc Special Services, who supports special needs students on the West Side. So we had a total of maybe 600 teachers were very appreciative. So thank you.
We was also able to start something that is passionate to me, and I wanted to always remember those that have served and come before us, and I always want to respect the rich history and the culture that we have here at West Ascension Parish Hospital. So I was sitting around and I wanted to think of something that we can honor some of I call them our legacy and our staff that have put in the time. So we was able to formally bring back 3 former employees who we inducted into our Champions of Care Memory Wall. You know, when you go to other hospitals, you have like a Hall of Fame. We want to do something a little bit different. So we worked on a Champion of Care. And we had a great ceremony. Mr. Bro, you want to mention that?
The hospital, out in one of the elevators was my mother, who was here approximately 30 years, and 2 other, Mr. Silent and Ms. Shakespeare. It was a really touching homeroom and touching ceremony for employees that worked for little or nothing, and to be honored years later was just truly valuable. Appreciate you.
Yeah.
Your mom worked here 30 years?
Yes, she did. She's a certified nurse assistant.
Is that right?
And what we did was we looked at 46 years.
Oh, amazing. Okay, wonderful.
But she'll be coming up. She'll be coming up. Don't worry. Coming up. She'll be coming up. But we picked those three young ladies so that we can be able to honor them and give them their flowers right now. So that's a great time. It was a great celebration. So we was glad to have that. Also, we started looking at what can we do for our current staff. And I was very honored that from our leadership team, our leader of the year, one that's showing compassion and selfless work and being able to be on the forefront of changing the culture that we have here and bringing back the stability of the best that we can be at West Ascension Parish Hospital. And that's Miss Alicia Falsetto. Miss Alicia is here today, so she's our
I'm here today. It's a pleasure to be here, and I was very honored for the award, and I look forward to continuing to provide to the hospital.
Thank you.
Thank you.
So we're glad for Alicia being here today. So I also wanted to go over, we are a part of a GPO. And our GPO is a group purchasing agreement that we have, basically with Vizient. So Vizient is where we have. And in Vizient, we are able to look at where we can buy, how we can buy different items. So we have a Vanderbilt Health Purchasing Collaborative. It's already under the Vizient contract. However, now we are a part of an additional 40 other hospitals throughout the state, throughout the United States. So now we'll be able to buy things at a better price. So we already was getting a better price, but now we're going to get a better price on more products. So for example, I can go ahead and say this. When we have oxygen tubing, you know what I'm saying? I was spending anywhere from, in a case, $40, $50. Now we can be able to get it for $20 because now we're part of a larger collaborative. And this is something that a lot of larger health systems use. So being a part of Vizient is where we're at now, is where the hospital has been for several years. But that's nothing to say that we can't move to another GPO. If there's something that's going to give us better pricing, better rebates, we're definitely going to be looking at that as well. Next thing is, the board challenged me last year to be able to look strategically and be able to look at what we can do for continued growth and development. So I just wanted to bring to of what we are looking at and bring to the board some ideas of that we have a behavior problem in our community. And we see a lot of patients that come through our emergency room each and every day that needs help, you know, and it's our objective to look at a lot of options to be able to provide care to everybody. So I did have the opportunity of speaking with GovCo, and I have them here today, just to give us a very high level of what they offer and what we can look at in terms of continued growth. So Shane?
Thank you. Carl Weininger, thank you. It's great to be with you. Carl Weininger and Shane Richardson, we're with Gulf Coast Behavioral Health. And we are experts in providing behavioral health services, both mental health and substance use treatments And we're looking forward to be able to provide this certainly needed community service. Of course, it's a nationwide issue, of course, right, to have at least 20% of our population struggle with substance use, and many don't have access. And that Ascension Parish certainly is not immune to that. In fact, we have less access than nationwide in general. And as you get into more rural areas, access, of course, decreases. And so we are also we have great history and expertise in being able to do integrative care. If we can integrate behavioral health into a hospital setting, you just have way better outcomes for patients. And of course, there's immediate benefit to the community. So, we want to first be able to provide outpatient services for counseling and psychiatry. And then there's great opportunities for further growth into additional substance use treatments, intensive outpatient programs, and other specialty needs for psychiatry.
Breaking things and dumping stuff over.
No, so I'm Shane Richardson. I'm from Ascension Parish. I've been here my entire life. Some of y'all know me. Some of y'all may know the name. I am excited to be able to come and present this over here. It is something that this community needs, that this community desperately needs. We in Louisiana don't have a lot of behavioral health and mental health services available to anybody, much less when you get into smaller communities that aren't right next to Baton Rouge, that aren't right next to Lafayette, that aren't right next to New Orleans. And so we're excited to be able to team up with West Ascension Hospital, be able to provide those things. Carl was talking about some of the statistics. So 20% of the people at any one time in your general population need behavioral health or mental health services. About half of those seek that out. When you get into smaller communities, smaller parishes, more rural, it's about half of that number. So you have about 20% and about a quarter of them go and seek it out. One of the problems is that they just don't have access to it. If you're going to say, hey, I need behavioral health services, I need psychiatric services, right? You're having to drive to Baton Rouge or you're having to drive down to New Orleans because you just don't have it available. And so we want to be able to come and provide that in partnership with the hospital. We think it's something where the hospital, just so the board knows, right, we're wanting to make the money for the hospital as well. And so this is a revenue maker. That's really what I talk about, but I am passionate about it. That's why we started Gulf Coast Integrative Health, so we could bring these services, behavioral health, physical therapy, family medicine, integrate them together. And it's a perfect partnership when we come in with behavioral health with the hospital, right? Because we can then treat the whole person, and we're not just treating one part of the person and then kicking them out on the street. We can help treat them so that they don't have those problems continually. And so we're really excited about it. We think it's a great opportunity for us. We think it's a great opportunity for West Ascension, and we're excited to get started.
Thank you.
Thank you.
I have a question, Shelton. How are the patients identified? Is it it's voluntary, or is it from the hospital you obtained to kind of get a referral?
Anastasia.
It'll be a referral from that.
It will be a referral from them.
Yeah, so we're going to be on site. We'll have people on site. So it's really an internal referral. And then we will go out in marketing into the community, letting the community know that we have these services available over here.
We also will have integration within your systems. So screening tools and other things that also will refer out, 70% of people that are here for behavioral health services also are not getting the physical care that they need. And so referring back to medical providers is also crucial. So both ways, having warm handoffs where possible and good client case management.
So they will have access to this service even if they don't go to the hospital.
Correct.
Okay.
I mean, the hospital will still bill it. It'll still be under the hospital, but they don't have to come into the ER to be able to get the service. If they walk in and they say, hey, I'm having anxiety and I really need help, or I'm having, suicidal ideation, I think, Look, I'm learning a lot about this stuff. I'm not that smart. So I'm having this. They don't have to go to the hospital first, right? Because we're integrated with the hospital. So we are part of the hospital. They can walk into the clinic here. We can get them the help they need. If we need to admit them, we can get them admitted. If we need to refer them to another specialty in the hospital, we absolutely will do that.
So in essence, you would be an outpatient facility within the hospital?
Yes, ma'am, exactly.
And you have your own electronic medical record, or you would?
So
integrate into
we
your-
do, but we would want to integrate into yours because the billing would all be under the hospital. We would want the hospital to have all of the records so that it is a seamless transition, right? We don't want to have to, oh yeah, well, let me fax this over, let me send this over. It's all already in there.
And does Medicare covers most of the costs?
Yeah, so as far as much of the cost is going to be reimbursed through Medicare.
Correct.
Definitely.
I can't say all of the costs, but what we would be charging would just simply be allowable cost that Medicare would reimburse.
So what are some examples of where you have this in place, either in Ascension or Louisiana?
So this is the first one that we hope to get into place. We started, right, with physical therapy. We've got several physical therapy clinics around the state. We have a behavioral health clinic in Prairieville. We have one in Ocean Springs. But this is the first critical access hospital that we're hoping to partner with to do this with. And luckily, right, it's my home, Ascension. And so this was a great fit for me because it helps my community.
You said behavioral health, physical therapy, and primary care?
Yes, ma'am.
You said you have one in Prairieville?
We do. We do. So if we have people that come over there that need the services and they live over here, then we can have them come over here and get the services here, right? So they don't have to travel over to Prairieville.
So typically, how long is the treatment plan?
You'd be able to answer that.
That's really dependent on the diagnosis that you'd be doing. You know, generally speaking, individuals that are coming in for anxiety or depression, those are frequently, 8 weeks to 4 months, right? Individuals with bipolar or schizophrenia, there's longer term care plans, a year or more occasionally. Sometimes, we'll have individuals stabilized and then we'll have ongoing care for maintenance for individuals, monthly injectables, of course, for certain individuals coming in for LAIs that need those types of services.
So are you guys trigger off of PHQ-9s or?
So that would be one of the screening tools that we would integrate in, PHQ-9s, GAD-9s, audit for substance use, alcohol abuse. And then if there's just specific needs that we're finding critical access components for the community, we can certainly look at integrating more specific screening tools. Yeah.
I have a question. Will you guys be focusing on pediatrics as well? We get a lot of.
Yes. Yes, ma'am. It's a huge problem, and it's one that often goes underserved, is the pediatric need, right? A lot of therapists just say, oh, we just want to deal with adults. And that's great. But if you can help them when they're kids, then you can get them on a better plan moving forward, starting young. So yeah, absolutely.
So become adults. I was just saying.
It's especially difficult to do, a hospital setting is especially helpful to be able to provide the pediatric need.
Where's your office?
We're in Prairieville. Yeah.
Standalone, not at one of the hospitals, that is standalone.
Standalone, correct.
All right.
Anything else?
Thank you guys for coming.
Thank you all very much. Thank you.
Yes, sir. So also I want us to also understand that, like I said, behavioral health is very, very important. It's passionate to me. We also started looking at working with crossover therapy across the street from us. And Ms. Hernandez couldn't be here tonight, but basically she's basically want to look at the growing need of behavior services as well. So we have two individuals, two companies that are coming to speak with us, which is great. So we're going to be looking at speaking with both to see what can we do. And then we'll be able to formally be able to bring that back to the board. But I just wanted to let you know that we here at the hospital, we're taking this issue very serious because it's something that's going over today. So there's no need for emotion or anything. Next is our van update. We was able to bring the check to our rep So they are working on getting the screen, and the van's going to be brought there in 2 weeks. And then we're going to start putting, making sure that's taken care of. We have also worked on aligning for the lift gate. So as the van is being brought to Baton Rouge, the lift gate is going to be repaired at that time. So within the next 2 weeks, we will have that taken care of. Anything else, Mr. Glenn?
Well, no, James, you got any more to add to that?
That's pretty accurate, and then we're gonna report at the next board meeting. Should have it ready.
So basically, that's what we're saying then, right? So the van will be ready for transportation at least by the next board meeting.
That's my goal.
Whatever else needed to be done too, we're gonna get it taken care of and have it ready to service our patients.
That's my goal. Yes, sir.
So how do we publicize this?
That's going to be a campaign that Kevin, I haven't even told him, but I'm telling him now. That'll be a campaign that Kevin and Ms. Chantel Dago will be work with further to publicize it and put that out to the community.
And we did really well with word of mouth last time too. Once one person knew about it, it just trickled off.
That's right. Because it's a need in the community. Sure.
I know we talked about like Council on Aging. Did we do anything with them or?
They do bring patients to us.
Okay.
So of course, we're gonna work alongside that.
Okay.
It didn't really affect their services or ours. It just added to the services.
Okay.
Next is our summer student program. And the good thing about, being an administrator is now I can just delegate and put stuff off, and stay a little bit away from that. So Kevin, that's your time.
All right, so Jamiko and I have been working on the summer healthcare discovery program. So Shelton had already prepared what the program structure looks like and the department rotations at that point. Jamiko and I started working on how we want to select the students, put together a criteria for that. So those things were published and been put online, as well as all the information that the student will need. We also went as far as like doing the interview and the scoring card. We have all the waivers and consent forms done. We've also have done a six-week program guideline for how those students are going to go through the departments. Also, there's a couple surprises and a couple off-campus trips in there for those students. I'm fortunate to know a very important person at Louisiana State. So we're going to take a trip there where the students will meet the director of financial aid, they'll meet the director of admission, talk to some of the student leaders there. They will also walk them through the process of how to complete their application for studies. So just an opportunity to be able to move from the facility to give them some of those highlights of what it looks like to visit a collegiate campus. So we're very excited about that. We get a week for the applications to go through the system. And of course, we know for a lot of the students, it's going to take a little more time. We did put a lot of criteria out there because we want to make sure the students that we are receiving are coming here to, one, be educated, and then also to give them an opportunity to advance and grow in a more professional manner. So definitely we kind of extended that date a little bit to allow the students to get those apps in. So by Monday, we should have all those in. Jamiko and I will go through those who formed an interview committee, and we also have orientation lined up for them. So we're excited about this.
But how many do you have that's
Did we go up? Didn't you ask to 25?
enrolled, or what's the number?
Do we still have the 15 we're enrolled in, or did the number go up? It's 25?
How many have applied? How many people have applied?
So thus far, we've only received 2 applications today.
But we do have the board recommendation, and those students are going to do their applications, okay? All right, and so have you talked about extending the program?
Extending the application?
No, extending the number of students that can actually participate.
So the number of students, from what I understand, has been extended to 25. So we have 25 students, but it's always been a part of our plan to not have to reject any student. So whatever the volume we get, we're going to do the best we can to work with it because, of course, we don't want to turn them away. We also looked at what it may look like, Jericho and I, if we did a second round of the program, if it got too big. Because unfortunately, we don't have the bandwidth to accept that many, so maybe going into next year, we can look at starting the program a week after the students are out of school, so we can do a two-week rotation, a two-time rotation, I'm sorry. But again, this is our first time doing the program, so there'll be a couple of things we'll have to work out, but again, we're growing, and as we continue to move forward with it, we put the program to accommodate it.
And probably beginning next week, the applications are gonna start rolling in because kids are out of school now and the word is getting around about this program.
Is the application only online?
They can also come in and see the app, so, but it's
Because
right now, it's one of the criteria for what the students will have to turn.
it's 6 weeks. Some student program, it's 6 weeks, correct?
6 weeks. 6 weeks.
And the pay rate is at $13.50 an hour, correct? Is that locked?
So, instead of doing the $13.50 an hour, we are going to award the student a flat, one-time disbursement. Instead of trying to do it weekly and trying to calculate hours. The reason for that is because, for one, those students would have to be put on payroll. There's a lot of legalities around that. So doing a one-time disbursement would be a lot easier because if that student has to be put into our payroll system, they have to do a background check, so they have to follow the same parameters as a new employee. So we found that it would be easier just to do a one-time 1099 disbursement to that student worker, and then that'll be done through our accounts payable department.
So you're talking about a one-time disbursement for the entire 6 weeks?
Yes, sir.
Okay, well then divided by, I guess, work hours. We want to see that rate can stay around the rate that we talked about initially because putting the word out, that's what we're gonna pay the students.
It is.
So what is that disbursement?
It's not 1,000 was the even amount.
Gotta look back. I don't have that in my head right now.
4,000 will not cover, how many hours per day? Just make,
Yeah, we're not gonna,
it's important that we stay close to the initial plan in terms of how much we're paying the kids, okay? Because that's what the parents and that's what the kids are excited about, so we gotta make sure we stay close to those numbers.
Have we talked to our insurance people?
Insurance people in regard to what?
Have we got these kids working for us?
Oh, yeah, absolutely. That's already been covered.
Yeah, they got insurance for that, yeah.
Oh, yeah, absolutely.
Youth job programs, all right.
And they won't ever be left alone. They will be accompanied by an adult. So they never will.
All right, very good.
next is our multimedia outreach that we've been working throughout the last several months to ensure that we are putting the word out via Facebook, via radio, and even working on live. So we've been working constantly. Ms. Chantel Daigle has been working with us. Chantel, if you would come up for a second. So Chantel has been on the air, going over commercials and explaining to the community exactly what we are doing in a way that she's able to reach a different subset that I cannot reach. I'm working inside the hospital, but Ms. Daigle is out in the community. So it's good to have a partner like Ms. Chantel. So
Thank you
Chantel.
so much. Hi, guys. For those who don't know, I'm Chantel Daigle. I live here, I have a business here. I'm all over the place. You guys know for sure. Good thing my kids are grown. I have grandkids, so I live alone. My dog died, so I have enough time to do a lot of stuff. Basically, I work with KBRS 106.9 FM here in the city of Donaldsonville. I also have a podcast that I do. But I had started out recording our meetings, like just on my own, because I don't not only just do this, but with the city council meetings and just things, so that way we can get the words out for us and for our community to know what's going on in our area. I started there. When I began, I think it was, I'm not sure, doing the meetings here, it was like in 2024, maybe like, I think April or something. And then when we transitioned to do the YouTube, I just decided to transition or start doing radio.
and advertising and commercials. So basically, I get with Sheldon, if he has something that needs to come out to the community, not only he tell me, and then I do voiceovers for them on the air. The way we do it, it's 24 hours a day. It's on both KKY 1590 AM as well as KBRS 106, and it's 24 hours a day for 30 days. Not consistently, it's just throughout the day, between other commercials. I have a show that I do Tuesdays and Thursdays. So when I'm on my show, I also advertise and talk about what's happening in the area or what the hospital is doing. Especially recently, I think you guys were going to do a health fair, but then we end up changing the date. Nevertheless, I wanted to come on because I never really officially gave you guys like a report. I mean, to actually let you know that this is what's going on. Sheldon and I always send messages to him, and he always quick to tell me this is what we have happening. A lot of times I'll print out sheets from my office and then take them places, to the library. I go to Midway, put it on their little board up there. I go to the city hall, because there's a desk where you can put information there. And then I am consistent at what I do, because I know from Miss Rachel, my granddaughter watches that when you repeat something, and the teachers could probably tell you, it's like a song. So I don't know if do you guys have that commercial up? Because it's almost like a song to me now, because I can hear it when I'm doing these commercials. Maybe you can give them a, where they can hear one of the mini voiceovers.
This is a special message from West Ascension Parish Hospital. At West Ascension Parish Hospital, we're leading the way in patient care, compassion, and safety. Our team is working hard every day to ensure that you and your loved ones receive exceptional care close to home. From emergency services to outpatient care and specialty clinics, we're here for you. Our wound care services are expanding to meet the real needs of our community, with personalized treatment and focus on healing. And in our emergency room, we provide comprehensive care, including cardiac evaluation, stroke assessment, respiratory treatment, on-site lab and imaging services, fracture stabilization, laceration repair, and so much more. 301 Memorial Drive, West Ascension Parish Hospital, your trusted partner in health. The trustees of our community.
What I want you to know is that I was in bed and it was late, and I probably did about 50 of those because it gives you a certain amount of time, to do the voiceovers for the commercial, because I have several other people that I'm doing commercials for. So I went over.
Good thing is she don't sleep and I don't sleep. So
wow, yeah. So I had to edit a little bit and add something, take stuff out. So I won't be long, but basically I'm going to continue doing that. I'm so happy and excited that the van is coming up, because I'm actually getting ready to start doing something called a mobile podcast, guys, for the city of Donaldsonville, right? I'm not quite sure of the name yet, but I'm thinking it's going to be something on the lines of the Donaldsonville Pulse. And what that is I ordered these microphones. So when I go out, of course, I'm going to get permission from everybody. Look like me, you guys, anybody, even young, if I get adults from the little kids, we want to hear from the community, because people have a voice and they want to know, that you think that they're important. And that's from my experience. A lot of times, especially elderly people in the senior apartments, if you just don't tell them or you don't remind them of something, they'll feel like they're left behind. So they have a story, and so they have a narrative. And so basically what that I'm going to do is the Donaldsonville Pulse, and it's going to be called FYI, meaning for your information. And it is what is your narrative, meaning everyone has a story. So we want you to use your voice. That's going to be coming soon. And I just wanted to just have that as something to add. And everything that I do, I always get approval from Shelton before I put it out there to do. So with that being said, I think that's the end of my stuff. I just wanted to let you know that was happening, and anything else that you have going on, I can put them on air, put out flyers, and wherever I go, I let people know what's happening in our community. So, all right, guys, you're welcome.
And just to finish on that, the other day I had a board member. I'm not gonna call this board member name, but this board member was at a place, and our video commercial came on. So she was.
It was a I'm not surprised though, because And I videoed the commercial. I videoed it and I sent it to Shelton and Kevin because and the other people in there were looking. So it was great to see. The commercial is.
And that's our WAFB commercial that we have going on. So I'm so glad. I almost finished for my reports, Mr. Dawson, but I just wanted to show this because this highlights, and it goes back to where we started at. This is April 2024, when I started here February 12th, 2024. And April 2024, I took over Rev Cycle. We was pushing our bills 30 days. So it was taking us from the time that we are looking at all the charges, time that we are closing charts, to pushing out bills, it was taking 30 days. I am proud to announce that as of the end of April and today, we are around 8 days. So we started with 30 days. We're down to 8 days. So bills are going out clean. All of the charges are dropping properly. That is because we have the right people in place now. That's because we have all of our CPT codes and everything that we are doing, we're making sure that we are taking care of our patients first. It took some hard work. It took us moving all of those old AR accounts. Remember, I sat up here month after month and I said, boy, just bear with me. We have to get over this hurdle. But this is just a year of where we have come from and where we're going. So I am very proud of this drastic drop to where we're at now. And it's also a benefit to our patients because now our patients can be able to receive their bills. It's also a benefit to our payers. Now our payers can be able to communicate with us openly, and we are moving those charts and those charges out. So I just wanted to show that to y'all so y'all can see exactly where we were at. First pass resolve at 79.8%. I am going for my goal. My goal is to be around 95%. So I got some work. So Shelton has some work. He's not happy with that. The DNFB, 3.2 days. That's where industry standards say we have to be. Your collections and charges, we're at 509. So I'm good. So if your patient is yielding 7.3, that's where we want to be at, around that mark. So this concludes my CEO report and our leadership team report. And now I'm going to turn to Mr. Dawson for your chairman report.
So let me ask you a couple of questions, or at least one question about this. Do we have somebody, or have we looked at the current legislation, the United States legislation and, the local legislation? I understood before they went into session that there was a possibility there would be some cuts to the reimbursement rate. What do we know about that?
So we do have a legislative update that's going to come in new business. Dr. Buggage is here, so she's been working with us at the Capitol. So she's going to give us a very high level of the legislative updates in new business. Yes, sir.
Okay, good.
Anything on your report, Mr. Dawson?
Does anybody on the board have any questions? Does anybody have? Eric? No? Great job is what, it's always fun to look at numbers, especially with the money when you have money in there.
Yes, sir.
We're not always used to that, but great job, Shelton, I'll tell you that.
Yes, sir. Thank you. Now, as we move into new business, we're going to go over some applications for review and approval.
We're going to have to back up and do public.
Yes, sir. I'm sorry. Yes, sir. Yes,
so if we have any public comment on the new business items, then if you can have 3 minutes. Anybody have any public comment? Okay, so we'll close the public comment request. All right, go ahead.
So this is for our application for review and approval, and I'm going to ask the board for two motions. The first is for Dr. Glenn LaFleur. He is with Blue Angels. He is our ER hospitalist, and he's seeking permanent full privileges. He was brought before MEC on May the 20th, and MEC approved his appointment.
So moved.
Second.
Got a motion and a second. Any opposition? Any discussion?
Next will be for Dr. Manuel Shalom, as well as Dr. Zachary Plotz, both are with StatRad, both are with radiology, and both are seeking permanent full privileges. Both Dr. Shalom and Dr. Plotz was brought before MEC on the 20th and approved for full privileges. We're seeking that approval now from the board.
Move. Second. Got a motion and a second. Any opposition? Hearing none, that motion passes.
Next, I would like to bring up River Parish Community College. This was brought before Mr. Dawson and with what a typical partnership would look like. So I have Ms. Gretchen here that's going to explain to the board what she have for River Parish. So we're glad to have you here, Ms. Gretchen.
Thank you, thank you. I'm Gretchen Schmidt, the Dean of Health Sciences at RPCC, and I'm here with my Vice Chancellor, Dr. Paul Donaldson. And before I get started, Kevin, I would like you to bring your students, when you do your summer camp, to RPCC, and maybe they can come play in our lab. So write that down. I have been working with Shelton basically since you got here, I guess, huh? And Anastasia. RPCC is like West Ascension. We are a small community college, just like you guys are a small hospital, and we know what that's like. We are between Baton Rouge and New Orleans, and we know that here in Donaldsonville, you guys do not have a lot of healthcare training programs at all. So lately I've been working with Shelton and Anastasia to bring this fall, we're excited about this. We worked on a grant that we did not get, but we are very passionate about doing it anyway without the grant, is to bring medical assistant training here to the hospital at night for people in the community so that they can get a medical assistant degree from us here on this side of the river.
Great.
And we're going to do it in the evening program, our evening program, so that people can still work during the day and be able to come to school at night. And when they finish, they will be certified medical assistants. That will open up jobs for them. And then also they can come to RPCC and transfer into our LPN program. We have an MA to LPN program. We're also looking at trying to bring CNA here too, on this side of the river, so certified nursing assistants. I know you said your mom was a certified nursing assistant. That also teaching people on this side of the river so they do not have to travel. We would love to be able to offer the next step, which is registered nurse, and we do not have that. Right now, we stop at LPN. So we are coming before the board to ask for $75,000 for a consultant to help me to do the steps necessary with the state board, the Board of Regents, the Department of Ed, to be able to offer a registered nurse program in Ascension Parish. Right now, people have to go all the way to Baton Rouge, or they have to go all the way to Delgado. There is no registered nurse program in Ascension Parish. So, and there's a lot of compliance and paperwork to do that. And so that is what the ask is for the $75,000, is for a consultant to help us navigate the red tape of state agencies.
I have a question. Is that, I heard you mention Ascension Parish. Would it be focused on this side? Would it be focused on the parish as a whole?
It would be focused on the parish as a whole, and
My follow-up to that, would we be footing the entire bill for that, or would other healthcare facilities around the parish help us out with it?
so this is an ask for you to help with the consultant. That's the first year. We have just to get it started. And then we have other community partners helping us with funding for buildings and classrooms and things on the other side of the river. And right now, this hospital is not big enough, and if Shelton keeps doing his job and growing it, to be able to handle the volume to do clinicals that nurses have to do. So we would be on the Gonzales side of the river. Any other questions?
So at one time, we talked about having a facility over here.
What?
We've been in conversation with him about, thinking you guys are gonna do the training for the steel plant.
Correct.
Correct? And so I haven't talked to him in a week or two, but, you know, that we were gonna participate in that we would have the healthcare training in that facility that they're building, which is, they bought some property right here close to it.
So to bring the RN program here on this side of the river, is that what you're asking?
Yeah.
So at first, when you do a registered nurse program, we are accredited at our Gonzales facility. So I'm not sure, you would have to have it started over there. And then if that is something, that would definitely be something to look at if you wanted to start it on this side of the river, because that would be a new site, that would be a different school. They would have to get, Paul, you know, about the offsite, yeah.
In terms of the new facility, we're very early on in the conversation with what's going to go into that facility. So those conversations are really starting here soon. And I do know Chancellor Taylor was hoping that health sciences would be part of that facility. In terms of which programs, we're still going through what's the build out.
If they tied up the land, they haven't bought it, I don't think.
The question was, have y'all purchased the property here?
It's in the process. I don't think it's done, but
He gave an update today. He said he was purchasing all of
so that's, you know,
all the 20 acres.
So it's complete.
pretty much done.
It's all, yeah, they were finishing it up.
Okay, so they're closing the deal.
Of wrapping up with Hyundai on that.
And that's right here. That's right here at the rear of our building here, right next to where we have all the property back here now, okay? That's what we're talking about, right?
So I'm gonna be perfectly honest with you. I mean, if the facilities are gonna be over on the East Bank and we're asked to pay for that, that's gonna be a hard hurdle for us to jump over.
Okay.
Yes.
I don't think it's a bad thing, and I don't think it's a zero, but I would like to see some participation from everybody in the parish.
Gotcha.
So it's potentially partial if we have.
Partial. So if I get other funders.
Yes, I can speak for myself, yeah.
Well, I mean, I'd like to have some of the training here at the hospital.
For the
medical system program coming in CA, certainly the hope would be that the nurses that we're training for RN would have here as well, right? Graduating for employment.
Oh, I agree.
Yeah, as things grow out with the expansion of the other campus, growth at Nelsonville, those are certainly opportunities. Just initially, we can only start one program at a time. So the Gonzales campus would be where we would initiate our first cohort for RN.
Yeah.
And we're about to start the medical assistance training program. That's gonna.
In the fall, in August.
This fall, okay. And is any of that education gonna be here, or some of the, part of it's gonna be here?
All right, next door on the other side of this building.
Okay. Medical assistant.
Here, on site, yes, on site.
And okay.
So on site.
The other campus, I don't remember the exact timeline of what that campus was built. So like I said, we're still deciding what programs. We're still in a discovery phase of what exactly do they need us to train for. Right? So we got to figure out what their needs are a little bit more fully. We're hoping to have a trip to go visit them actually this summer and get a better idea of how they do their training. And then that'll let us know what space we have remaining in the building for other programs.
So you're talking about the Hyundai group?
Yes, sir.
Yeah.
I just want to clarify I'm not against this, just, it seems like this study is based for the entire parish, so I would like participation from all of the health systems. But if we, you know.
So this isn't for a study. This is actually for someone to help actually get the program up and started.
Right.
So.
And so if, you know, we go through this and then years later, there's something that's supposed to happen here, absolutely, we can sit down and we'll probably pay for it. Or some answers that benefit not only us, but everybody else.
Gotcha.
I'm a little scared.
All right,
You know, I'll be honest with you, you ought to be able to get that money out of some of these big hospitals.
The medical assistant program, so that would be here.
Correct.
But this 75,000 is not for this program, it's for the RN.
For the RN program, yes.
So who's funding the medical assistant.
I was going to say, between RPCC and West Ascension,
Okay, so, but that's here.
that's here.
And we're talking about future when we say RN.
Correct, because it takes approximately 2, sometimes 3 years to do the paperwork, to do everything that you need to start your registered nurse program, to get it going. So. Any other questions?
I think we have a few more, or some different ways to look at this, but I don't think we're ready right now.
Okay, that's fine. I'm open to any questions and anything that you want to know about how that process works, and things like that.
Well, myself, I think that you've got to bring in this training facility. If you're going to put one right here on our campus or close to our campus, then, this needs to be coordinated. Well, I don't want to see us go and spend money over there on the east side. I used to like the east side, but.
What we need over here. We need it over here.
Dallas, we have other campuses and other parishes that we.
Yeah.
Yeah.
It's hard to make that commitment right now, not knowing what's going to go in.
Yeah.
Right.
Yeah. I mean, part of the conversations that we've had with Quentin is that, that's going to be something good for the community college as well as it's going to be something good for us. And, then we also have this $15 billion worth of construction that's going to go on here. We're going to have maybe 7,000 workers here. Some of them are going to need a hospital. And so, we've got to watch what we spend our money on here, that we don't pass up these things that are going to come.
And we're not saying that because we just say, oh, we want to hear on the west side, just because. We're saying it because we're looking at our population here. And
I think it's a great idea, and I think it's something that can move forward.
yeah.
I do, and I understand that, and it is the reason that we're starting the MA program on this side and the CNA program. We are trying to build it up so that you have healthcare training on this side of the river. Yes.
And there are certainly other partners we're talking to about funding opportunities. This is one.
Okay.
So this would not be the only contribution made towards getting that program started. This would just be the initial step.
So, yeah, we'll continue that conversation.
Well, thank y'all.
Thank you.
Dr. Levy, I do want to appoint you to be the board spokesperson for our MA CNA program to work with Ms. Gretchen and Ms. Anastasia. So would you accept that task? Thank you. Yeah, I'm getting used to this delegating stuff now. You like it? Like it. Next is going to be our legislative update. Dr. Buggins, will you please come up for us? So Ms. Cynthia and I, we've been working hand in hand along with Mr. Reshort on the legislations that are moving through the state level as well as on the federal level, and how that's going to be directly affecting what we're doing here on a local level. The biggest one that has really affected us, and Ms. Cynthia was there with us and Mr. Reshort was there, was House Bill 607, which talks about hospital service districts and talking about just a specific district that is trying to move in and take over on other areas. So the Rural Hospital Coalition is what we are a part of, and we're totally against that. But that bill has been pulled, so that bill is going to be looked at next year. But we're also looking at the reimbursement rates and how we're looking on a Medicare, Medicaid standpoint, and what that's actually going to do for critical access. So Ms. Cynthia, I'll turn it over to you.
Good evening, everyone. As the CEO Shelton Anthony said, we were in attendance on yesterday at Senate for HB 607. We were sitting there for hours and waiting and thinking something might happen, but knowing probably nothing was going to happen. And the only reason I say that was because one of my senators, or maybe two of my senators, about 2 weeks ago said to me, we're going to probably kick this can down the road because we're not wanting to get involved in the lawsuit. So we kind of were okay because we didn't, it was no favorite one way or the other. So we can still operate as we are. So yes, and these are just a number of bills that I've been looking at and attending the committees on both House and Senate side. Mr. Chairman, if there is anything you'd like for me to focus in on, let me know. And so I've been attending the, let's see, appropriations, because it's always, starting where the money is, and seeing what they're doing in reference to hospitals, Medicaid, Medicare, and payments. And so there is another bill that I've been looking at and tracking for you guys so that I can share with Mr. Shelton. And it is disparities for rural hospitals task force. And my request is to the chairman of that committee, which is Representative Dustin Miller, to allow our CEO to be a part of that task force so that we can see what's going on and have some input in what is going on in that area, the disparities for rural hospitals, which, I've heard you guys say often, they're left out. And so we want to make sure that we're at the table and our voice is heard. The other one is, I'm looking at next week, a bill by Senator Kirk Talbot. And that bill has something to do with Medicaid reimbursements during disasters and how they are going to be approved. And I think that I'm going to try and follow that so that I can share with the staff here and Mr. Shelton and Mr. Quincy so they can tell us if we need to go to the table and say something contrary or pro to whatever it is that they're trying to do. Again, if there's anything that you guys are interested in, let me know so that I can, because I've been on the Capitol grounds for a few times now in the last 3 weeks, quite a few times, actually.
Cynthia, so the bill that you just mentioned, dealing with disaster, what bill number is that?
That's SB 182.
Last one on the list.
Yeah, and so the others are just sort of, HCR 55 is a concurrent resolution, and that's the one with the total, the committee and the resolution for Dustin Miller, and I say Representative Dustin Miller, and that committee, and that's the one we're trying to get Mr. Shelton to be on the committee for, rural disparities, rural hospital disparities. The other ones are just sort of Medicaid related, and I'm just trying to keep my eye on that in case something that needs to be said to the hospital, or we want to weigh in on some of them. And that's pretty much our report. We're just going to keep going. The next time I'll be there is on Monday. Well, there's a Sunday Senate session. I've just been looking at the agenda to see if there's anything, and I don't see anything that we would be concerned with in reference to that. But there's Monday, there are two committees that I think that we should be in. So one starting at 9 a.m. And the other is, I think, right before the 1 o'clock session starts. And so we're attending both the sessions as well as the committee hearings.
And Cynthia, one more question.
Yes, sir.
At the federal level, the new budget is being proposed by President Trump. My understanding is there are some Medicaid cuts.
There are some Medicaid issues, and I will send the email to you guys. I sent out to a couple of people already, and I haven't sent it to you yet, but our congressman had a concern, and he put that out. The ether, Char Carter. And so I wanted to make sure that we were all on the same page with that, and you guys knew in case you wanted to say, yeah, I'll go that way, or no, I need you to do this for us. So we are looking at that as well. We just haven't been to DC, but we're paying attention to it.
You look at it, if you look at 68% of our total business is Medicare, Medicaid, 68%. So I have already tasked Ms. Cynthia to make sure that we know any type of cuts that's going to be directly affecting our hospital and directly affecting our communities. And I'm going to be very passionate, and I'm not going to give up, and I'm going to make sure that our voice is heard by the recommendations from our boards. And Ms. Cynthia is going to make sure that she is allocating on our behalf to address those issues.
So nothing will be done before talking to you guys.
Okay, just first appearance here. So I'd like for you, I mean, we're lucky to have you, and you've got a broad background of experience here. I'd like for you to just update if you don't mind, your qualifications, experiences I don't want 2 or 3 days worth, but
Okay. Well, certainly, thank you, sir, Mr. Chairman and board, as well as Mr. CEO and staff. I am Cynthia Buggage. I am PhD in public policy. I have had more than 40 years of experience in federal as well as city, state, and in some instances, county, as well as not necessarily parish here, other than I am back home because I had Congressman Charlie Malonson call me on the phone one day and said, well, I saw a 985 number and I didn't know what it was because when I left home, we were 504 and 225, which tells you how long ago that's been. And I didn't answer the phone every time that number came through. And so finally one Saturday, I answered the phone and he said, Cynthia? And I said, yes. He goes, this Charlie boy. And I was like, who? And he goes, I said, Congressman Malonson? He goes, yeah, I'm interested in you coming back to be one of my top staffers. And do you want to come back home? And I said, I want to come back home. So here's where I am, but I've worked on Capitol Hill under 3 different presidents, as well as I've had 3 different members of Congress. And the city of Houston was my first job out of college. I was, what was I? I had so many jobs. I was an administrator for grants. So I have a varied background because I literally, when I saw it, if I thought I could do it, I went after it, and most often I got it. So I've literally been in public policy most of my career, but I was actually an assistant athletic director and business manager and marketing person for a university in Houston. I was with the county, Fort Bend County, which is adjacent to Houston. And so done a lot of projects, was able to get a Boys and Girls Club. I was able to fundraise so that I can get the Boys and Girls Club in Fort Bend County, which was one of the signature events for our commissioner. But I'm happy to be back home and anything that I can do. And I always tell people, well, if I know them, you know them. So if I can do anything, I'm happy. And I want to make sure that we follow the legislation and, follow the money to make sure we're getting our share.
I have a question. My understanding. So you more like advise them like on public policy and bills?
Well, it's sort of like advise, it's sort of like lead them in a certain direction. It's sort of, we wrote as well as, we had lawyers like Mr. Quincy to tone, fine tune whatever it is that we wanted to do. But yes, literally as a chief of staff or a member of Congress, I was sort of the advisor, do whatever needed to be done to get it done, talk with whomever, cajole, whatever, however, just as long as it's all legal, because I wanted to come back home and I wanted to make the news for winning the lottery, not for something bad.
Cynthia, you were chief of staff for the late Sheila Jackson.
I was chief of staff for the late Congresswoman Sheila Jackson Lee, yes, and district director for Congressman Al Green and director of outreach for Congressman Charlie Malonson. I've had the pleasure of working with several presidents, probably spent more time, which is interesting, at the White House with President George W. Bush. And I don't know if it was a Texas thing or what, but we were there often.
thank you.
Thank you.
All right, we almost finished now. So now we're going to our ER policies. Board, I did have the honor of sending you all 20 policies on via email the other day. Ms. Mitchell and Anastasia, you can come up. Just to give us an overview of our policies.
Hi, guys. Again, so just as we mentioned last month, we'll be rolling out 20 to 40 policies every month. You're going to see a variety of departments from emergency medicine to inpatient to social services and so forth, financial management. These, we wanted to start with our biggest bang for our buck, right? We're seeing a lot of patients in the ER. We need policies, but we need protocols. We need to know how to use them. And there are certain regulatory components that we have to make sure that we have. So as you can see, like Mr. Shilton had shared, that you've gotten a copy of the policies for review. We have them broken up into buckets. So administrative, requirement, regulatory components, and then some of our nursing and or personnel as far as how we're running protocols. So there's a lot of fancy language and jargon, but this is what keeps us running. And these are the things that we have to audit. And then these are the things that we review in the ER committee from both clinical outcomes as well as quality outcomes, and that get reflected back to you. But it's just our governing part of how we operate, and then we can also look back on how to utilize it for patient care. Any questions?
A great job you're doing.
Thank you.
So all 20 policies have been before ER committee, have also been before MEC committee, and I'm asking for full approval from the board to approve our emergency department policies and procedures 1 through 20.
They've all been approved by me?
Yes, sir.
So moved.
Second. Motion, we have a second. Any opposition? Hearing none, and motion passes.
Right. And thank you, Mr. Chairman. Thank you to the Board of Commissioners. This is all I have for new business. And I'll turn it over to Mr. Dawson at this time.
Okay, so item 8 is executive session, and we have 4 items that fit that definition that requires an executive session. One is EMR software selection, and I assume this RS 42. Where's that, Kenneth? Is that the hospital exemption?
Revised statute.
That's the
Allows us to go into executive session. All right. FMOL HS Contract Services Agreement. Again, there's this exemption for hospitals that are looking at plans or strategic plans. Litigation strategy, Henry Chauvin versus West Ascension Parish Hospital Service District. And 4 is CEO Employment Services Extension. So first, does anybody have any public comment on any of these 4 items? I don't see a vote on any of these. So when we come back in, it will be simply an adjournment. But if somebody has a public comment, now's the time to tell. No. Okay. So we'll need
I'll make a motion to enter executive session.
have a motion, have a second. We'll need a roll call on this. We have to have
Mr. Bill?
yes.
Yes.
Yeah.
Yes.
Mr. Bell?
Yes.